A Mayo Clinic study that examined 286 patients seeking a second opinion found that only 36 of those patients received a second opinion that matched the first. 188 received a second opinion that better defined the initial diagnosis, and 62 of those patients ended up with what the study calls a distinctly different diagnosis. This means that roughly 1 in 5 patients who saw a second opinion received a different diagnosis and treatment plan. Now, unfortunately, patients are often uncomfortable questioning their doctor's diagnosis. But how do doctors actually feel when you request a second opinion? To find out, we asked 3 board-certified orthopedic surgeons, and here's what they had to say.
I welcome second opinions, both for my patients that I'm seeing primarily and they go and reach out to another physician, as well as seeing patients who have already gotten 2, 3, 5 opinions in the past. The most important thing we're hoping to accomplish is an understanding of what's wrong in your body and how can we get you the best result possible. And before we take a chance on your life, putting you under anesthesia, cutting on your skin, and looking to improve your body, we must all be sure that we're doing it for the right reasons and that we are anticipating a result that's worthwhile going after from a risk-benefit profile. And so at the end of the day, I think the decision to move forward with surgery is an incredibly important one. I think all surgeons should welcome the role of multiple opinions before we move forward with it. And in the case that we have eventually spoken with a few physicians and everyone's in agreement that that's the right plan and the next step to take, at that point you move forward with whoever you feel most comfortable with and who you feel you'll have the best result with.
I encourage all my patients to seek additional opinions if they have additional questions. It's never a bad idea for a patient to see multiple surgeons to see what they think about their condition. You know, if you see 4 or 5 different surgeons and they're all telling you pretty much the same thing, usually that's a good sign that you're on the right track. However, if each surgeon is telling you something completely different, then maybe that's a sign you should hold off and think about this. So getting additional opinions usually will help the patient to crystallize what their condition is and make a good informed decision moving forward.
Oftentimes I'll recommend the patient seek a second opinion because I would prefer for the patient to be absolutely comfortable with whoever's performing the surgery and knowing that they've answered the questions that they want answered. We see a lot of second opinions here at the Mayo Clinic. It really is a tertiary care center, and vice versa. Some of our patients need and should have second opinions as well. And I never object to it, and I try to make the patients feel comfortable because sometimes it's a little uncomfortable for them to even ask.